And ahead of the fall season, you can now receive a brand new COVID booster. It has a big update. It finally protects against Omicron. The CDC signed off on the new boosters, and it is recommended for those 12 or older, vaccinated or not. Right now, CVS and Walgreens are already offering appointments online for this new booster. So the new shots were designed to target not only the original virus, but also Omicron BA4 and BA5 variants. And joining us now to discuss this new shot and its effectiveness is Dr. Niva Johnson. Thank you so much for being here.
You're welcome. Thank you for having me.
You know, it's important, right, doctor, because BA4 and BA5 are the dominant strains in the U.S. right now. We know there are 91,000 new infections every day. So what is the message? Should people be getting this even if they were already vaccinated or boosted, or even if they already had COVID?
I think it's important for those who've been vaccinated and or boosted to get this booster, because it does help with preventing infection with the current variants, as you stated, BA4, BA5. They are probably the most contagious variants that have existed since the start of this pandemic.
And, you know, we have seen some pushback to the vaccines in some people. How would you respond to someone who is concerned about safety or says these new vaccines didn't complete full clinical trials with the FDA? So why didn't the CDC wait for those trials to finish?
Well, these vaccines were released similar to those that are released annually for flu vaccine, for influenza, in that those vaccines do not have human testing also before they're released every year. And so they went through the same process that is for the influenza vaccine also. Another benefit of getting vaccinated to prevent BA4 and BA5 is that reinfection does occur with COVID. And there are now studies that show that people who get reinfected with COVID are at greater risk for either long COVID or other health issues.
Yeah, I really appreciate you pointing out that that important point. It's not even about the initial infection, which may be mild. It's about long COVID, and it's about the impact on the rest of one's life. I do want to ask, are we expecting another COVID wave in the fall? And what does the latest data tell us about when that might occur?
Unfortunately, every year when we go indoors in the fall, we get another wave. And unfortunately, this week, that wave may have already started. At University of Illinois in Urbana, one day earlier this week, there were almost 400 positive COVID cases. Now, school has only been in session there for probably 2 weeks, and already an uptick was seen. And so it makes it really important for everyone to go ahead and get this booster if it's indicated for them.
Dr. Niva Johnson, I certainly appreciate your time, and your point is well taken. Thank you.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.